You can't get up, right?
I think we were provide all of through, but I think this agenda looks manageable to get through before 3. So, and I know we have a couple people that have already said they have to leave a little bit early. So I think we have a quorum. It looks healthy that we have a quorum without even counting all those, but it looks like we have good folks on the phone. So, so welcome to 2019, everyone. We have some new board members here today, so we want to welcome them. And so we're going to start with introductions. And as we do our introductions, we also have an outgoing board member who is John Sinclair. And so as we do introductions, I'm going to pass around a card and ask those of you that would like to sign the card to John. As we send his thank you letter to him, we will send it with the card. So I'm Rhonda Hoff. I am from Yakima Neighborhood Health Services in a community health center in Yakima. I represent the housing sector for the Greater Columbia, and I am your president for the next year. So we'll go, I'm going to pass the card this way, and we'll go introduction-wise this way.
Okay. I'm Brian Gibbons. I am from Sunnyside Hospital, and I represent providers, treasurer of the board for the upcoming year.
I'm Sierra Foster. I'm from Sunnyside Hospital as well.
I'm Rachel Guest, and I am from GCACH.
Becky Coleman, GCACH.
Diane Halo, GCACH.
Patrick Jones, Eastern Washington University, but I'd like to just point out I'm wearing a basketball tie today because Gonzaga, number 5 in the country, is playing the game.
I noticed that.
And Madeline Carlson with People for People, representing transportation and secretary for the board.
Ruben Peralta, Greater Columbia HDH.
Dana Otis. I work at Lord's Counseling Center representing behavioral health.
Welcome, Dana.
Thank you.
Ronnie Batchelor, I'm representing consumer. I work with Lord's.
You're going to have to speak up for the folks on the phone.
Oh, that's right. I'm sorry, you guys. I apologize. Usually my voice carries. Ronnie Batchelor, consumer sector. I have a switched new job. For those that don't know, I'm working with Lord's now, and I'm doing the True Blood mobile outreach team.
Wes Lucky, Greater Columbia ACH.
Horace Engels, coordinated care observing.
Dan Ferguson, I run the Allied Health Center of Excellence. I represent all the community colleges and their health training programs. I represent workforce development on the board.
Susan Grindle, Hope Source in Kittitas County, representing social services.
Welcome.
Thank you.
Carol Moser, Greater Columbia ACH.
Ashley Fernandez, Greater Columbia ACH.
Shanna Shelton, Greater Columbia ACH.
Martin Sanchez, Greater Columbia ACH.
Harry Green, Three Rivers Community Foundation, representing philanthropy.
Martha Landman, Columbia County and Garfield County Public Health, representing public health, and Vice President.
Welcome back, Martha.
Thank you.
And I'm Les Stallnaker from ESD 123, and I'm representing education.
Lauren Johnson, Greater Columbia ACH.
Jorge Rivera, Molina Healthcare, representing managed care organization.
And welcome back.
Welcome, Jorge.
And officially on the board.
Finally, I would say.
So,
After all these years.
on the phone, let's see, we have Cicely.
Yes, this is Cicely Zorn from Quality Behavioral Health.
You, Julie.
Julie Peterson from Kittitas Valley Healthcare. I represent hospitals.
Thank you. Sandra.
Sandra Suarez from Yakima Valley Farm Workers Clinic, and I represent FQHCs.
Thank you. And a couple of other folks not identified. Would you like to introduce yourself?
Yes, this is Ruben Alvarado, representing local government.
Hi, Ruben.
And this is Tanya Chris with the Yakima Nation Behavioral Health, representing the Yakima Nation.
Great. Thank you, Tanya. Is there anyone else on the phone? Okay, well, welcome everybody. So, as a reminder, We ask everyone to review the attestation of conflict of interest and self-dealing transaction policies. As refreshers, and look through the agenda, and please either now or as we get to each item, speak up if you feel like you have any conflict of interest on any of the agenda items. Under the consent calendar, we have just one item, which is the board minutes from December the 20th. Feels like a really long time ago. So if anyone has had a chance to review the minutes, I would entertain a motion to accept.
I have I think there's a language inconsistency. On the last page, we have chair, vice chair, and we have president. And are we using the term chair or are we using the term president?
What do our bylaws say? We just have to have president.
So then we need to change it all to be consistent with that if we can. And then if that's done, then I'll be happy to move that we approve the consent agenda.
Okay, so I have a motion to accept the minutes with the change noted to change the title to be consistent with our bylaws.
And I was here in person, not on the phone last month.
Okay.
Oh.
So would that
Yeah,
change as well?
I'm happy to include that as part of the motion.
Okay.
Was it seconded? Maybe we can just redo it.
Sorry, Madeline.
No problem. And so I have a motion and a second to accept the minutes with two changes noted. Is there any further discussion?
I'm sorry.
All in favor?
Aye.
Aye.
Any opposed? Okay, minutes are approved. Thank you.
I'm sorry. Left motions and who seconded?
Madeline.
Madeline. Okay, with the change. Thank you, Madeline.
Okay, so Greater Columbia report of updates. Carolyn.
Right. So, we've been giving the board kind of two different types of report formatting. One is very narrative. It's the GCACH report that is in your packet. And usually the staff goes around and shares a little bit of information about, what's happened the past month. We started the Leadership Council meeting with, some just reports from Greater Columbia. And and the thing that I got out of State of Reform this year, which I get out of the State of Reform every year, is this idea of a social contract. And the idea of building social capital through the sharing of information that all of us as healthcare professionals carry with us that know that have to be communicated somehow. And that when we do, we can bring a higher level of care to our citizens. So I think the greatest example of that, as I spoke this morning, was the conversation that we had about the ACEs campaign and the importance of getting this information out to the general public, and almost a social contract with our public to let them know how resiliency plays into childhood ACEs. So that was my highlight for the report. Additionally, I had a lot of fun at the State of Reform this year because I felt like for the first time I could really interact with all the presenters. I had a base level of knowledge that I could contribute to the workforce discussions, the behavioral health discussions, and in some instances challenges some of the speakers about their thinking. For example, I think when I went to the pre-conference with Doug Bowes from United Healthcare, and he was talking about Pathways being the best model. Well, he didn't say best, but he referred to the Pathways model as a model of care coordination that has been widely adopted across the state. And I said, well, actually, Greater Columbia did not adopt the Pathways model, but we're finding other ways of care coordination that meet our needs. And I think it's important when you're at these conferences to be able to speak from a local perspective. Our local, especially with the legislators who did a presentation on behavioral health integration, I talked to them a little bit about some of the work that we're doing, and they were very excited to hear about this potential scholarship that we might have for incoming behavioral health, either the providers or the students themselves. So Dan and I rushed right up to Lori Jenkins after that presentation and told her what we had on our agenda, which is very consistent with what's happening at the state level. So I just, I think it's really important to know what is happening at the state level, what's happening at the national level. And so that was the benefit of going to the state of reform. And we had several other staff members and a ton of highlights that they took away from that. The list continues. The only correction that I would make is that at the top of the second page, really Governor Inslee has set aside $90 million for those initiatives for behavioral health, not 900. Although 900 would be great, we should probably correct that rumor, so.
Before you go on, can I ask a question?
Sure.
At the Leadership Council this morning, and I think this is probably directed towards you, Jorge. Caitlin or Kat, one of them, when they were talking about care coordination and health home, made the comment that the state requires the managed care organizations to all use different platforms. Did I hear that correctly?
You heard it correctly, and I don't think they meant that they require us to use different platforms, but the reality is that you end up using different platforms.
Well, I know we're all using different platforms, but is it required by the state?
I do not believe it's required by the state, but I will confirm, because I heard you too, and I made a note on that.
Okay.
Yeah, I thought the same
That's
thing.
one of the biggest,
Yeah.
it's one of the biggest problems that we have to use so many different platforms. And so I was kind of hoping that would be one of our
That's
goals.
what I'm doubtful, because I know we use different platforms, and I know for care coordination organizations, sometimes it's an issue on specifically on health homes and everything.
Yeah.
But in health homes, it's very damaging that you cannot see the member with a single view.
Yeah.
So I'll find out if it is a requirement.
Okay,
I'm not
thank you.
sure it is.
Sorry to interrupt.
No, I'm good.
Great point.
So we can just go down the line.
Okay, so next in the report is the payments from the executive portal this month. And I just want to highlight that one of the big payments we made was $225,000 to everyone that participates in our work group. So that was a big payment that we sent out. So thank you for all of you who are here that participate in that. And then the other big payment that we made was we paid off the BHO contingency fund, which was something that the board voted on in November, I believe. So those payments have all been made. So those were our two big ones, and then there were couple little small ones made to our providers that are still catching up on some of our other things we did earlier this year. And then the second thing I want to say is you heard her introduce herself. This is Rachel Guest. She is the new Finance and Contracts Coordinator. So she will be assisting me, and she did assist me in making these payments, and I think she's catching on really quickly, and she's learning a lot. She has a little bit of a healthcare background from her previous job. So we welcome Rachel.
Thank you. I guess I'm next. So I sent out an email blast through MailChimp. I believe it was last week. All the days seem to run together. But Everett Maroon had reached out to Carol and I to get the word out there that there's naloxone availability in our region. So here's a little explanation of the availability. It's available while supplies last, of course, but if you're interested in learning more, you can reach out to Everett Maroon with Blue Mountain Heart to Heart.
Can I ask, how does that message get out to the different organizations like behavioral health and SUD in counties different from every area of service?
We're going to talk about it in a private provider meeting, but I also have sent out a message to the behavioral health.
Excellent. Thanks.
We also have a distribution list that's almost up to 700 people now. So a lot of those individuals and organizations are probably included in that distribution list as well.
Who's going to do practice transformation?
Oh, I thought we were doing
Oh.
welcome to the board.
Yeah.
Yeah, so I can do that. So practice transformations are moving along. We did an update to the toolkit, and we've just been working through that. And also, it's been we've been scheduling meetings just to go out with the providers and with the organizations and walk through the toolkit and the milestones, and we've gotten really good feedback. I think everybody that kind of saw it as a really scary, long document. They kind of nod their heads in unison at the end and just say like, okay, this is doable. So, and they're really excited about it. So it's been really good.
And so for our first learning collaborative meeting,
Yes, the first learning collaborative, we walked through the milestone reporting schedule, milestone by milestone, fielded a bunch of questions. So it went really, really well.
and all organizations were represented.
You're good. Oh, here's me. So since I become the opioid resource network specialist, I've been going to a lot of different webinars on opiates, and the last couple that I've gone through all have been about MAT treatment, medicated treatment assistance, and for addiction in the ER, and how these have been established in some of the ERs. In fact, Missouri started this. There's an article that I put together. They started it in their ER, which is the medication first model, and it talks about the different strategies for that. But then also over in Swedish hospital, they also have a similar program like this. And I believe Lord is going to be starting this program, starting in the ED as well, after they get their MAP providers, the waiver and everything. So it's kind of exciting that these things are happening, and we're really excited about the opioid learning symposium summit thing that we're going to meet with the Northwest Pacific University and go over, try to pinpoint down when it's going to be and what it's going to be all about. So we're really excited about that. So I'll go ahead and talk about the IMC as well. So the providers all are, as of January 1, they switched over to the billing with the MCOs. There have been a few bumps along the way, but we've been having calls 3 times a week, meeting with Healthcare Authority and the MCOs to resolve any of the issues that are coming about. There are some that take more than just them, so they have to reach out to the subject matter experts in the Healthcare Authority. So if there's you hear of any questions or anything, just let us know if there's something we can do to help get some answers for you. And then also we're going to continue to have the provider readiness. So I kind of have 2 goals for a little while. We're going to keep having the provider readiness meetings for the providers so that they can have a place to discuss things with the MCOs and Healthcare Authority. And the other thing is I know she brought up that, Rhonda brought up in the Leadership Council, there are having webinars for the early warning system indicators that were provided to the healthcare. So the healthcare will be putting that on once a month. And so I can get that information to anybody who would like it.
My turn? All right. So this year we set aside some funds to provide some training and some and send local health improvement network active participants to trainings or conferences that would help increase their knowledge and their expertise that can assist in the population health goals of our region. And I included there as an example the Beyond Paper Tigers Conference and trainings also this June in Pasco. The theme for this year is building resilience across the lifespan. And so yeah, that's an example, and hopefully we can get as many people to attend this conference this June. And like I said, we have money to make sure that every LIN is represented. And the last page, we also set aside some funds to collaborate with organizations that we're not formally contracted with and that we're not currently providing funds to. We set aside some funds to sponsor some events they might have going on, like pay for food or help pay for speakers and that kind of stuff.
Ruben, is there an application process or?
Yes, we have for the sponsorship. For the sponsorship, we have a policy already written for it, and we have an application process. And we're going to put one together for the trainings and conferences for LIN leaders. So there will be an approval process for that as well. Thank you, Janet. I just forgot that part.
So now we're going to go kind of to our dashboards. We've been trying to keep track of all the progress and trying to work up a way for the board reasonable to be able to see at a glance, you know, the progress of certain areas. So, Ruben, why don't you go ahead and talk about the Lynn tracker?
Yes, this is like Kel said, the Lynn tracker, the one in the section in green. These are the deliverables for the 2018 contract. Pretty much the only part that's left to be completed is the proof of financial stability, which is due on the 31st of this month. Yakima sent it already, so that is in progress. All the Lynn's know about it. They're working on it, and hopefully we get it before the 31st. The bottom section is the Community Health Fund deliverable tracker. I just corrected, if you look at Spencer Franklin Community Health Alliance, like Kurt mentioned at the Leadership Council, last night, they selected their social determinant priorities. So now they're at the point to where they need to work on the scope of the projects to turn it over to the third-party administrator. So hopefully that will be done before the end of the month. Blue Mountain, it's still in the process of collecting consumer input in their deliverables. They're trying to reach 100 surveys. They're at approximately 36 surveys already, but this week they're going to be collecting. They have several places that are conducting surveys, so probably by next week they'll hit the 100. Is that about right, Martha? You were there, right? Yeah. GCACH, well, the contract is completed with the third-party administrator. Carol reviewed it already, and it's going to be signed any day now, I believe. And after that, it's just a matter of us transferring the money, them signing on to the portal, and us transferring the money. So they're pretty close. Southeast Washington, they have selected their social determinants priorities. They're in the process of writing the scope and coming up with some matrix, and then turn it over to the third-party administrator. Whitman County, they're in the process also of selecting their social determinant priorities. Yakima, we're just waiting for the third-party administrator to sign on to the portal so we can transfer the money.
And Ruben, the dollar amount there, that's 2 years worth of the community health.
Yes,
is that
correct.
right?
Yes.
Great. GCACH effort tracker.
Sorry.
So this is the PCMH tracker that we are using for the different organizations that we're working with for practice transformation. As you can see, we have added dates instead of just having the X's, so you guys can get a better idea as to when we meet with each organization. There's a few more dates that we're gonna be adding in the next couple months as we get this work going. But so far, we've had some practices turn in their contract signed. So there's some dates on there. Some have already started working on their budgets and completing them, so it's just a matter of turning those in. Once we start working, we'll be adding more dates. And then between Jenna and myself, we have split the organizations and the locations. It was 22 to 24 between each one of us. So we're going to be doing a lot of driving in the next couple months and meeting with all the different organizations and getting some more dates onto this tracker.
Any questions? Okay, Becky's back up.
I'm sorry. Who's the PCIW in here? Sorry.
That's the practice transformation implementation work plan.
It's the change plan.
Yep, the change
Okay.
So I talked about this a little bit in the report, at least this first graph here that shows the payments that we've been making out of the portal. So I won't go over that too much. The next one is the behavioral health providers. Go down a little bit, Lauren. So as I mentioned, also we did pay the remaining balance out of the contingency fund. We're still waiting for, well, actually, we just got the budget from Lord, so we can pay them next. And then Tri-Cities Community Health finally signed their contract. Thank you for everybody that worked hard on that. So we'll be making those payments. Tomorrow, actually, Rachel and I have a meeting to discuss the payments that'll go out on Monday. And so all those providers will see payments in their accounts on Friday, the following Friday.
And all the contingency funds.
Yes, all the contingency funds got paid out in the last pay period. Well, besides these, Tri-Cities Community Health, but so we'll be having those contracts closed at the end of this month. I'm so happy. So thank you everybody for your hard work on that. I know it was a lot.
So do we know if, on the contingency funds, if the BHO providers decided to go forward with their consultants?
They did not.
Funds.
Most of them used the funds. Most of them, when they updated their budgets, they put the funds into use for carryover funds for the first 3 months, since we don't know if their payments are going to be
Right. So before we sent them the contingency money, I requested that they update their budgets to tell us what they were going to do with that money, and they all did.
All of them put it in there.
But nobody did the
Used it for the
used it for the
consultants.
consultant. Wow. No. So that was a lot of work for Diane. But
You learned something new.
always learn something.
I mean, that's the whole thing. Is now our contract with the state is now over as of the 31st to manage that project. So I have my final report to go in, but there's some lessons learned that we didn't know as we went through this whole thing, and so that's what maybe next month.
So can you give us a thumbnail of what the biggest lessons learned
The
were?
biggest lessons learned is we were trying to be diplomatic and allowing the providers to determine the funding formula, and I think that we should have, handled that internally.
Definitely. And I just, from my perspective, I think having a better plan in place for the contingency money would have been a better, to have that in the contract, because there were so many providers that were asking what it was going to be, what it was going to look like, and we didn't know. I feel like it should have been spelled out in the contract. It's a lot of money.
We should have had a way for the smaller organizations to be able to apply for that money to be used for other, new computers or new software that they may have needed. But unfortunately, I had brought it up a couple times in the meetings, and it just got tabled. And so I think that would have been something that if I could have done something different, that would have been those two things.
Yeah, I think when we look at the littler providers, the smaller providers, they were the ones that really got hurt, because there was so much money that went just to a few organizations, and then the smaller providers just didn't have as much, funding that was available. So, that, we were trying to honor the request of the providers, but I think going into this next IMC money, the $6 million, I would like the board to be a lot more proactive and and looking at the way that we allocate those funds.
Exactly.
Is that's sort of my next question was, I mean, that was specific to BHOs. Are there other potential, whether it's the behavioral health providers or any other, whether it's the community-based organizations or primary care, are there other scenarios where these lessons learned could be applied that you see coming down the road?
I think the way that we did the PCMH allocation was really methodical. It was very, we agonized, over how we were going to allocate those fundings. We used the change concept to guide some of the decisions for the practice transformation work group and the budget and funds flow group. So I think having more structure around any kind of a formal process like that would be really helpful, because we were able to show with the PCMH money, how does this align up with all of your change concepts? And then how does that align up with your what you're saying in your current state assessment. And then we use that as the revenue model too. So
Right.
I think it was a really great process.
So you would reproduce that model?
I think,
Yeah.
I think
that's
I
right,
would,
too.
because there just needs to be a nexus between what the providers are doing and what we're trying to help
Yeah.
support. And then when we don't have any control over that, then it seems like that there's just, we don't know what the outcome's going to be.
Right, you gotta sort out those details to conclusion, and otherwise you're fighting about it at the end, right?
Yeah.
Yeah.
So do we need to spend time on understanding the mechanisms of how these decisions are being made and how that could be changed as more funding comes for the behavior, particularly when it comes to the behavioral health system, because we know this year in the legislature there will be new monies for the behavioral health system. It's a priority from the governor. It's in the agendas of some of the bills. And if the mechanics that we have here implemented in Greater Columbia favor the bigger providers over the smaller, that is the other thing that through the 3 years now of integrated managed care is we've been working in the smaller providers surviving and staying alive all the way from southwestern Washington to north central to the new regions incorporated. But if the mechanics are not there, and if the decision-making process leads to some sort of voting mechanism that always preserves the bigger guys in town, that's not going to work. The question is, I personally don't even know what mechanisms are.
So I think from what I heard Carol say is that we have had a mechanism on the primary care side through the Budget and Funds Flow Committee. They developed a formula that was presented to the
it's
board.
work, but I guess my question would be, how do we have the authority to port that mechanism to whatever comes? Let's say that there's new bills in the next legislature approved by the governor, and they fund another $20 million for mental health in Greater Columbia. Is it as easy as to say, do we have the authority to apply those formulas, or who gets the authority? Because can that be the BH dash? The one thing I've never been able to say, BH dash ASO.
No, they're not part of that. That funding will be part of our
I mean,
decision.
I just want to make sure that we have the mechanisms to actually act upon those funds in a way that the community, the entire community votes on it and knows the basics of the criteria. Like, it is in our best interest to protect the smaller providers.
And I think if Cicely's still on the phone, she's with Quality Behavioral Health, it'd be interesting to get Cicely's perspective on this. If you're willing to.
So perspective is that I think there was a lot of confusion. I know that the providers were asked to meet in the beginning to talk about the first set of funds, and then we assumed that we would keep meeting for the second set, and that's where the breakdown happened. But we're willing to work with you guys on, however you want to do it.
Can I add to that as well? I think additionally it was difficult because providers.
Just want to say your name so that.
I'm sorry. This is Dana. This is Dana Otis. I think it was difficult because the providers were coming from a system that they had been in for years, and there was some fear around what was this going to look like moving to the integrated managed care and how this would play out. And so I think that played into this desire to have input into it. And I agree, I don't know how well that worked out because there were initial meetings that did not have good follow-up to subsequent for how the funding would be allocated.
I agree.
Well, I think during the process of this, we have made some clarifications that we've identified through this board, a body that is representative of both large and small employers in the behavioral health world, right? That we consider to be the advisory group to the board. So that, going back to Jorge's question, when we receive an allocation, and I would have to say I'm kind of equating it to what the Budget Funds Flow Committee did. I thought worked very well. They came up with a formula and a methodology toward our goals long before we knew how it was going to affect individual providers. That made it very objective, so that we all had a chance to look at it and see where the logic was. And then it wasn't so much later that we attached names to those organizations. And so, assuming that the budget and funds flow, Darlene's not here today, is she?
No, but curious.
Okay, you were on that committee? Okay.
Co-chair.
Co-chair. Oh, great. So assuming that that you all are willing to carry that work forward, that seems to be a good process. And the question would be, depending on which group and which goals it's setting for, it would be a matter of developing a process using those, whatever the goals are for the next allocation, and then bringing it back to the board for recommendation.
Mm-hmm.
Right. Great.
I think that's fair.
Okay, are we ready to move on? I see the financials up. But, and before we talk about the financials, Brian and I were talking before, two of our committee members on the finance committee are no longer on the board. And so we're a little lean.
Yeah,
We're very bright. We need a couple of other people on the finance committee. And Julie, I know you're on the phone, but your name came up as one possibility. And we're wondering if you might be interested in joining the finance committee.
No pressure.
Yeah, it's not very hard. Becky does all the work.
Julie, are you still there? Okay, well,
I'm gonna reach out to Julie.
okay, but we can still use at least one other. Is there anyone that has a particular interest and would like to serve on the finance committee?
How many hours is it?
It's not much.
It's
really just
an hour a month. Or, yeah.
An hour a month.
So when you're new to a board, usually there's a quick conversation of what other committees are out there that you can. So are there any other committees that you guys think others can help?
That's probably a really good discussion
Yeah.
for the board meeting. It's like, what are the existing committees that need participation and new
Because I'm
blood?
happy to sign up for this one, but then if there's another one,
Well, this is one that we knew needed some attention.
Yeah.
So
The budget
can-
and
we
funds
don't
flow
have
committee
a-
is missing a few people also. We asked for volunteers at the last
who?
meeting. I haven't heard anything yet. Budget and funds flow, we're also missing. We lost four members.
now I'm wondering
last
why
year.
is there two of those?
The budget and funds flow committee was not restricted to just board members.
Right, that's correct.
So the finance committee is.
Right.
So we can certainly do that, and we can maybe get a list and send it out to all the board members of what committees we have.
In the
But we
meantime, I can
specifically
just
for the finance.
volunteer. I can do math.
Well, we'd love to have you on.
Meeting on
I know Excel.
So you're gonna reach out to Julie.
Yeah.
And,
I'll work
okay.
for it.
No.
No.
Okay, it would be great.
And then can we send out a list
I'm
of the
not on the
committees to the board and see if anyone has
have
particular
to see
interest, and we'll go from there. Thank you.
Perfect.
Thanks for having
Great,
us.
thanks, Ken.
It's gonna be nice.
But I have on Tuesday.
Okay, Becky, so do you want to take us through? Becky and
Okay.
Brian?
All right. So you have all of the financials in your packet, the statement of activity and the, with the explanations of what all of these fund numbers actually mean. This document that's in front of us on the screen here is our roll-up, which is what we usually try to talk to. So, and this is end of year, so this is kind of exciting to see, I think, to see how the monies were flowed out of GCACH this year. And so we'll just kind of go through it. The first box that talks about our revenues, which didn't change from last month. So we'll kind of just keep going through to the next box. Our investments, this again is our money market account. So I think most of you know this, we hold all of our operating expenses in a money market account, and then we draw down from it when we need to pay the bills or pay the payroll. So we earned total for this year $71,000 of interest on that account. And fun things that we talked about in the finance committee meeting was better ways to possibly invest that money to make even more money off of it. And in February, all of the ACH CFOs, me and everybody, all the other CFOs and ACHs are getting together, and that's actually one of our agenda topics. So I'm hoping to glean some information from the other ACHs what they've been doing with their funding, because I know some of them have done some different investing than what we did. So hopefully I'll have something to bring back to the Finance Committee next month. The next box is the expenditures from our design funding. So you can see there how much we totaled for payroll this year, our contract services, and then the column that is the third column in that is how much over budget or under budget we were. And part of our meeting last week with the Finance Committee group is we talked about the other services and miscellaneous costs that we had so much over budget for that group, and so under budget, excuse me, not over, under budget. So, and a lot of that is Brian thought we should talk about it here, is that was a lot of that was our IT budget, and that is being carried over into this district money this year, and so that will be paid out. I think Wes talked a lot about some of the IT contracts that we're working on, so I won't go into that, but.
We don't want it to look like a fudge fund.
Yeah.
That's all right. So I actually had that question about it, and I know we've talked about it a few times, but that is the anticipated IT funds that we were at one point thinking that we would need to park in case we had to hire consulting to build it, correct?
Right.
We did a lot of that stuff internally.
Yes.
So we were able to support those dollars.
Right. It was just a big unknown at the beginning of the year, and we're I think we're on the right path now for next year. The next group is our expenditures of our STEM funding, excuse me, and that money is it's exhausted. Diane mentioned before that contract is over, ending the end of January, so we won't see any more STEM funding for next year.
So the 82,066 was what was left over in the STEM funding?
Yeah, and yes, thank you. So that money is being moved over to the opioid project.
Okay.
Yeah, that's their kind of seed money for, I think we talked about at the leadership meeting that for the opioid summit, it's going to be.
Right, the development of the resource networks, whatever, how that takes shape.
Yep. So let's see, moving on to expenditures out of the district. I talked about that already a little bit, all the money that we expanded out to our providers and our payrolls, what you see there. Mayor group funding, that hasn't changed. And then the expenditures, the next box, the Yakima Valley Community Foundation money, that's still sitting there also. So the box at the bottom, and then Lauren, actually, can you go to the next tab? The recommendation finance committee meeting was to create a pie chart that kind of shows all of our expenses for the year. And so, where'd it go?
Minimize
I think we eliminated it.
Bring it down.
Go back.
So
Undo.
You're an
Undo.
X. And go all the way
Hit
to
undo.
Yeah, click A.
Oh, there.
Undo, maybe?
Yeah, undo.
Yeah.
Great,
I think you deleted it.
There.
Oh. Undo.
There
There it is.
Don't
touch anything.
So, Rachel put this pie chart together based on the complete roll-up box that's at the end of the first document that we were looking at. And so this shows the complete roll-up of our payroll, our contract services, our facilities, operational expenses, travel and meetings. And it was just a recommendation from the finance committee that we put together kind of a visual. Not everybody's a numbers person. So this kind of shows where our largest expenses were, which of course was payroll.
Okay.
So are there any questions for us?
Can you remind us what the AmeriGroup funding is for?
Yeah, it was a grant that was given to us for social determinants of health.
So we need to roll that into the community health.
So we have a plan for it?
Yeah.
So I have, Ron and I spent some time with Becky and her team the other day, Friday, going through all of this stuff. We went through line by line, and I'm satisfied with the output. I think these are very, very good. You've done a nice job with this stuff. I would like to make motion to approve these financial statements as written.
Motion to approve the financials, is there a second?
I'll second.
Second by Jorge. Is there any further discussion or questions? Not, all in favor?
Aye.
Aye. Anyone opposed?
Thanks,
Are there
Becky.
any abstentions?
Yeah, no problem.
Thank you, Becky. Takes us to revised operational budget.
Right. So last month, the board approved our fiscal year operational budget, and we had a little bit of a hiccup when we were putting all the information together. All of us send all of these documents to poor Lauren and say, oh, replace this with that, and replace that with this, and we had a little bit of a mix-up. So we had mentioned that we were going to put $30,000 into the sponsorship of community events, but your budget last month only reflected $5,000. So this is an updated budget. It increases the budget by $25,000 because we do want to honor that commitment of sponsoring community events. So we apologize for that little glitch. We have since migrated to OneDrive, so now we have a shared drive that we can all get our documents into, and we can share editing. So that was just a little bit of a hiccup.
Finance Committee discussed this as well. Thought it would be appropriate to advance this to the board, perhaps as a budget amendment or a budget revision, either way works. So we would make that recommendation to advance it.
I have a question.
I think we need to have a second first before we can open it for discussion.
Second.
Now I have a question. So most of the programs I have, I don't do budget revisions unless the budget change is greater than a percentage of the amount, and I don't see this as a very big change. So that's why I was saying I didn't know if we really needed to do a revision, or if it just needs to be informational. That was what I was asking you.
Yeah, no, that's fine. I frankly like having I like having them written down.
Mm-hmm.
Track of it, like a better term, but I agree with you. I think it's a very minor amount relative to the global. I think it allows these guys some guardrails.
Confidence.
They know where the edges
Okay.
are, and I would,
All right.
that's the only reason I bring it forward.
I think it's great. I just was curious.
I appreciate that. Thank you.
Any further discussion or questions?
So is there like a certain amount, I'm just trying to figure this out and I'm wrapping my head with it. So is there like a certain amount that you would do a revision at?
It depends where our funds come from, and that's what my funds. I have a 10%. I can move my funds 10% from one budget category to another, without going through a budget revision process. That doesn't mean I turn it into my fiscal person. They make the adjustments, but it doesn't have to go through all the processes.
So Brian, how can we stop that in the future where it's not a significant, but keeping track of it would be relevant, not having to go through this kind of process?
I think and it's a good question. Thank you. From my perspective, what I've kind of shared with Becky and Carol and generally with the Finance Committee is we try to set up a beginning of the year, like, all the dollars in and out, right?
Right. I do that at home.
Sure. But you also move things back and forth.
I do. It's called like robbing Peter to pay Paul.
Exactly. And so from my perspective, I've not really had a big issue moving dollars from one area to another, as long as they're inside of that big box of how many dollars we have in the budget.
Right.
Right. And so what we're doing here is essentially suggesting that we had come to the board the prior month and say we're going to do X and Y and Z.
Right.
And then we had to change it to A and Y and Z. And we just want to match them up so that what we presented to the board on the go forward for the year, we've actually got that stuff all written down. Later on, we may, you may need to move dollars from one area to another area. Maybe need to rob Peter to pay Paul kind of inside the same box. We probably won't bring that.
Right.
Right. I think those are gotta have a little bit of discretion on that. So I don't think we have any set protocols as to if it's 5% or 10% or 22%.
Right, so why don't we do that, so that the board doesn't have to go through this, and you don't have to
That's okay.
do the whole explanation and be questioned by Les about accountability,
That's fine.
or not.
That's fine. We can do that, whatever the pleasure of the board.
Okay.
And we did move money around
Yeah.
last year
Yeah.
from, I mean, we didn't add money, which is what Brian is saying. The money, the bottom line dollar was always the same, but we did move money around to different categories when
So,
under budgeted and.
so this is not adding money to, this is just moving money around.
This
to-
is
adding
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 money,
to.
And this
which
is
is
why-
why we're
and that's
bringing
why I
it a
wanted to
little
bring it
more.
in.
Yeah.
Right.
So is there some way that we could put in this, a certain amount to be added without having?
I don't find this a burden to do.
Okay.
Yes, and I think it protects the staff.
I'm just wondering, I'm just asking questions.
No, it's fine, but that's kind of my perspective too. I think we can, as a board, we can say, okay, guys, here's the number. Knock yourselves out.
And I appreciate having the, finance committee kind of identify those things that they feel are most important.
Right.
I'm
Mhm.
relying on their direction for that as well, so.
So I'm just asking questions.
That's fine, and that's why you're here, and I do like this. It's, like I said, it gives everybody the direction, it gives us all the protections, frankly. And that way we all know. So I appreciate it, and I think if it became burdensome, and it may become burdensome as we start moving a whole lot of dollars later on, but I think right now I'm comfortable leaving it as we are,
Thank you, Brian. I appreciate it.
if you all are good. Okay,
Are
thanks.
there additional questions or comments before we call for the question? Okay, so all in favor of accepting the revised budget as presented, say aye.
Aye.
Hi.
Anyone opposed? Any abstentions? Okay,
Thank you very much.
Thank you, Brian. Thank you, Ronnie, for your question.
Oh, hey,
Welcome.
I'm just trying to figure out.
Elton
If I can wrap my head around it, I think everybody else can.
Who's talking about that?
Where
Oh.
is the elephant contract?
It's not in the packet, 'cause it's so large.
Oh, okay.
I didn't print it, but it was sent via email.
Martha?
I have a concern on the new LHIN contract that it just seems like it's increased, deliverables, from 10 or 12 this year to 20, over 25 for next year. On the LN aspect, just looking at it, I was hoping to spend the LHIN money in the community, not on the process of meeting all the deliverables. And I think, that would have to change, and that would be a major change in our LHIN.
So can you talk a little bit more in detail about it?
It's just, I think some of them maybe can be combined, or maybe they could be a little bit more opaque, I didn't have time to go through and from yesterday to today to have specific suggestions, but I think maybe we could combine them and make them a little broader. And so they weren't so defined.
Have you guys talked about this?
No. I just got it yesterday, so I haven't had a chance.
Honestly, the reason that we brought this to the board, because really we're thinking about just, first of all, just taking it to the LHIN leaders, but we wanted, because there's 3 of you that have been very involved in your local health improvement network, we felt like having a discussion at the board level would be really helpful, so that if you wanted to make changes, we could do that. We do have a quarterly meeting set up with the LHIN. And some of these deliverables have come out because the board will say, oh, this would be a great idea to send it to the LHIN. For example, the workforce study was one of those that we thought that should go through the LHINs. And then I think the communications committee also had something that they wanted to add. So I think as we've started working with the LHINs, we've recognized how valuable this community connection is to our work. That being said, I think it maybe be helpful to go through all the deliverables and have a discussion about the deliverables as they stand. So I do want to go to I think it's the last page.
The scope of work page.
And the three people that have been involved are Ron and I and Martha. Is that correct?
Susan, Martha, Rhonda, you.
I have not seen it.
Yeah, right. This hasn't gone to the LINs. This is only going to the board right now.
And should I have gotten it as a for the board?
You probably did in your packet. It went out to all the board members.
Yep.
Yeah, it went
Yeah.
out in the packet. So we just got it like,
Yeah, I think I
Yes,
updated
sure.
it Tuesday night.
So the first is submit a report to Greater Columbia describing how the funding from 2018 contract was utilized by the LIN.
2019.
And I don't know how you want to do this, Rhonda, if you want, comments right back now, if you think, some of these are too onerous.
Well, how many are there? I was in my mind, I was trying to figure out why this wasn't ringing a bell.
Lauren,
So
can you
you
flip
told me that we
through?
haven't seen it yet.
it's
so I feel better.
scheduled in the exhibit, the deliverables is scheduled.
But
Milestone
this
report.
wasn't part of our 2018 contract. Yeah. So I guess my first thought would be, this feels a little bit backwards to me. But I don't know how the others feel, is that maybe it would make more sense to take it to the Lynn group first and get their feedback to bring to the board.
Mhm.
Does that make sense to the rest of you?
Is the one thing that resounded with me this morning in all the talks was a little bit more flexibility in the language of what we do so that we can get the work done that's specific for the needs in our local communities. And I think if we look at this, I think this is a good example of maybe we can combine some things and make them a little bit more generic and a little bit more flexible and still meet the outcomes that you're expecting here.
Okay, but there are a couple I think that are really important to staff, and one of them is the purchasing of teleconference and equipment so that other people can call into your meetings. And I think that needs to be a very transparent effort on all of our parts. We just got our results back from the Community Health Evaluation Center. And again, community engagement is lowest in all of the ACHs, but until we have mechanisms to help the community engage with our activities, it's really hard for the staff of Reuben to be in 9 counties at one time. And so that was added to the contract as something we thought would be really important in helping with community engagement. I think another thing that was important is having a local voice when we're talking about workforce needs. So that was added to the contract because the local communities are the ones that know where the workforce needs are in the community. So we felt that would be an important activity to work with the LINs on that.
Well, that's a good example, I guess. And I'll look at you because you're so involved in this. Why would that be part of this contract when the Sentinel Network already does that at the local level?
Well, the idea here, and this is a really good conversation because it's kind of like, which should come first? The review by the LINs or LLN. Anyways, or kind of this broad overview and kind of philosophy, kind of development statement by the board. And so, and the Sentinel Network is a really good example in terms of workforce development. So not everyone around the region knows how to use, access, use, kind of digest, analyze the data from the Sentinel Network. So the idea coming from the committee is actually do a training for all 5 regions within the ACH on how to do that. And actually use that as kind of almost a pilot project for the whole state. That would get rolled out maybe at the World Health Conference in late March. So that's why there's kind of some time issues associated with it. So I agree that there should be some kind of stage setting at the board level. I don't know that we have to go through every detail, but it might be helpful that, I mean, if in the local region they're reviewing this, to have somebody there to kind of help frame or understand So like, when we do it at Yakima, it's gonna be fairly easy for us to kind of understand some of the details of it, but that might not be the case in every region.
This is Sandra. I actually agree with Rhonda's comments, and I'm sorry I didn't catch who was commenting after Rhonda about maybe going back to the LINs first. I think it's a good opportunity for us to check in with the LINs and make sure that we have a full understanding of what their capabilities are, because each of the LINs is at a different point in this process, and some have more capacity than others to meet all of the requirements. And so I can understand why some would want a little more flexibility, or even really just actually need the flexibility more than just even wanting it. And I think it would be good to know that before going into some of the decisions. I mean, I think a lot of the things that you did add, that you spoke to, Carol, I think those are all great, but I think it's just a good opportunity to check in with the LINs and kind of do an assessment that way before we move into the contract.
One more thing, it's a little bit of informality. Is there a quick conversation that can be had with each link on what the more realistic, this is what we need from you right now? The contract is a big document and needs to be dealt with as a big document, but to your point on conference equipment, maybe it's just a call to the Martas or the Sus and say, hey, can you buy these? And we will make sure of the mechanisms to allow you to buy those things, to make the whole thing a little more practical before there's even a contract, is what I'm suggesting. I don't know if those conversations have happened.
They have not. But we were hoping that within that $30,000, they could use some of that money to fund equipment. And then as part of our contract with all of our providers, we have asked for budget. So we have a budget document for the PCMH, we have a budget document for the BHO providers. We have, and so asking for a budget from the LINs, we think is very consistent with what we have been asking of all of our other providers. And then, so I think that we're trying to protect Greater Columbia and trying to be fair, because we think that if we're going to ask one group to provide something, then we should, it makes sense to ask about accountability for all of our groups. But I would be curious, to know which of these deliverables are that the LINs find really onerous. So last year we had the discussion around the Medicaid Consumer Council, and that was taken off the table, and we ended up with the surveys. So things like that, I think we're just trying to head off at the pass, so that if there's something that the board finds that that's really an unreasonable thing from a board perspective, then we can say that. But we don't want to get into this fight with the LINs to say, well, we think this, and then have inconsistency even within the LINs of what they think is acceptable and what's not acceptable.
So, for instance, looking at the Fairfield County Health Network LIN, is that when you say Facebook setup, I can set up they can, I'm not, trust me. They can set up a static Facebook. Or are you talking about a Facebook that is operating as you would rather see it, where it's always updated? And those are two very different levels of investment that staffing-wise they would have to do. And conferencing capabilities, does that just mean you have to buy equipment, or you have places in your county where you meet that have them? So it's those kinds of scalability things that would be helpful to know in saying yes or no. Identifying workforce needs for sure would be a harder one, but those two, depending on what you're looking for, may have a different answer from us.
There's a bit of a description on so this is mostly just a payment schedule. And to go back up to the first exhibit, it talks more about each of those things that are in there, and specifically to the Facebook one. I kind of wrote that out a little bit more to say any kind of social media. Social media is such a huge part of our world right now. We felt like that was a really good way, like Carol was talking about, reaching out and engaging with the community.
Right.
So it doesn't have to be Facebook, but some kind of...
has a scalability issue. Anything with social media, I can put it up there and there it sits. Or I have one and I need to work with it and update it and make it more attractive and all of that. So whatever the social media is, it's going to have the same issue.
So
I guess and again, I need to ask if there's a time-sensitive nature to this. And if the local coalitions or LINs, whatever you're calling them, have the opportunity to provide some feedback. One of the things that, in my mind, thinking back a year or two, that we wanted to create these local entities was so that each community had the opportunity to develop and meet the needs of their local community. And if we get too detailed or defined, this sort of takes away from that. I don't know how our group would feel about saying we need to maintain, and I'll just use that example. We need to maintain a social media presence. Is that a priority in our community? I don't know the answer to that, but it'd probably take a fair amount of discussion to do that. Where we might decide it's important and Martha might decide in her community it's not. How do we maintain that local autonomy other than aside from being just a satellite of the ACH? So, I mean, it feels like it needs to have some of that local conversation before we know whether this works for us or not.
And
So
I
is
think
there a
that-
time-sensitive nature?
Yeah.
Yakima already signed their contract?
Pardon?
Has Yakima already signed it?
Not for
Nobody has.
2019.
Oh,
It has.
so the contract does end.
It has ended.
It has ended.
The current land contract ended December 31st.
Right.
Okay. So there is a time sensitive.
In order to get more money.
Right.
It has, when is that? When does that close?
The current land contract is done. Is done.
Oh, it's
It is
January.
December 31st.
Okay.
Yep, it's done.
Less and then less.
Let's go ahead. You had your hand up before me.
So I guess, if you look at the purpose for each of these, maybe the purpose is what is important and not the detail. So setting up a Facebook page, what we're looking at is having a public-facing presence. That's the important part. And then the other side of it is, and how does this organization support that? So we're saying you need to have a local-facing presence, and you're saying this, we don't have the capacity, so the bigger organization comes in and sits down and sets it up and helps you get going and maybe coaches to take away that huge learning curve at the beginning to help it get going. And I guess and the way I read it is that it's a sort of a cooperative thing. You're going to do your thing. We're going to come in and help to make sure it runs, and you get help. Is that right? So I guess I could reword things in a way that says you need to be able to have this public presence, and then Martha might say, yeah, I have no idea. Then the communications team would give you some help. Versus you have to have Facebook or something like that. I don't know. I just think that because some of these things make a lot of sense. The workplace thing, what about how do we do our workplace needs? And then, okay, someone from ACH can come in and say, here's the tools, because we did a lot of tool development in the beginning. Here's the tools, here's coach you on how to use them. Maybe we can come up with the answers. So it doesn't become a burden, an administrative or that kind of burden in a community.
I agree with you, Les. I think that there could be some piggybacking with others, like let's stick on the social media one some more, right? Like somebody in your community already has a Facebook page. Maybe you could post on it once in a while, or somebody already has a website that you could post an article on once a month. I think you're right, Les. We could reword this so it's not so specific to Facebook and make it more open just to have some kind of social media presence.
So I hope everybody picked up on some of the comments that Carol made at the beginning of the GCACH report that we picked up out of the State of Reform for those people who weren't there, where DJ Wilson talked about this creation of social capital. Social capital is simply the structure of relationships within a community that makes the community more self-supporting, more robust, more resilient. So when we put things in there around Facebook, that's just not to brand the organization. I mean, I think the purpose of that is that there's a place where Yakima can post when you go through your brief and sassy, some of those things that are being called out in the community, individuals know where to go to find out about resources. We're also talking about trying to create a community resource directory of some sort. That in itself also builds social capital. Having a telecommunication tool allows not just the GCACH, but perhaps other people regionally who can't attend the meeting be part of that meeting. that creates social capital. So I think we're going towards a primary objective here. A lot of these seem pretty reasonable. To buy the telecommunications equipment and have a go-to meeting subscription, that's less than $500. And the capital equipment is only bought once. So in terms of some of these deliverables, I think that the reason why those are put in there is to create that social capital at the local level. And I would say, Rhonda, that frankly, the LINs are representatives of the ACH at the local level. 2017, Carol and I and others had this conversation. We can't be at all places at all times. So in a way, you represent us in our programs.
Jorge?
Understanding everything, this conversation right now, we're trying to find the middle ground that works for the needs of the GCACH and that works for each and every one of the LINs. I understand that we are out of contract right now, and I'm also looking at the Exhibit B milestone reporting schedules, and the first due date is in April. Do I understand that to receive the next funding, they need to meet some goals in April? And if that's the case, can this first quarter of the year be a period where there's more agreement on the expectations and also more sensitivity to the small differences or maybe need for technical assistance of some of the regions? Because, you know, Facebook activity in Yakima is not nearly comparable to Facebook activity in Pomeroy, although everybody uses it. People in Pomeroy use more the mainstream diner than people in Yakima. And I say it because I've been to both. And I've been to Ellensburg diners. So do we need to make a decision on accepting the contract or not, or do we need to foster a conversation on what kind of content the contract has between now and when the next milestone of funding needs to happen?
And how do you deal with the first quarter's funding, right? I mean, because you do need to.
Yes, it could be part of the conversation. Because I don't think we're too far. I think, you know, the reality, the document came out a day ago. They will have to read it, they'll have to bring it, but faster than reading the document, maybe it's a 20-minute conversation with every LIN that is more pertinent to the needs of the LIN, and maybe in Yakima, that's a 2-minute conversation, we can do all this, but maybe in Southeastern, it's a little more, can you help me with this? You know, do we need 5 different purchases of conference equipment, or maybe we ask Wes to select one that works for everybody and we buy 3 of those?
Other thoughts from board members?
I think Jorge is right, and frankly, I think to your point, when you're buying equipment, and I may be wrong, but it seems to me that as that's prepared, you're asking the LIN to put the dollars out, and they're essentially reimbursed later, correct?
Yeah.
Well, through the fund, right.
Mm-hmm. And then if they already have the equipment, they still get paid for it.
Right. Exactly.
Like, or if they are at a place that facilitates that, as long as they have a way for them to do it, then if they get paid for it.
Right.
And I really like the way that Les kind of framed it as far as really looking at that purpose behind that, and then allowing the LINs, the individual LINs, kind of identify, you know, how they're going to achieve those goals. So the goals are, you know, engaging the community, having that information available, and really allow the different lenses looking at, you know, the achievement of the goals, and not being quite so prescriptive in the language. You may instead of you.
The other thing about this is that there could be partnerships that make these things happen.
Right.
I just was mentioning several schools have
a little bit less.
Several schools have fairly robust capacity to do these distance things, like GoToMeeting. We're using Zoom now, but so if you went to this organization or the library or wherever in your community, they may already have this. So I guess buying it and then ahead of time might not be useful, because it, you know, using what's there maybe, or they have old equipment and they would really love it if we could come in with a newer piece and then everybody in the community could use it. It might be a useful thing, but you know, that would be community specific.
Yeah, I don't see anything on here that we can't,
in Kittitas County we don't already do or can't already do. So that wasn't the point, that we couldn't do it. But I didn't want to think we were, you know, in a sweet spot and then find out later that we're not.
And I think sometimes people think, oh, yes, we'll set up a Facebook page, and then getting anyone to really like it or follow it, a whole different story. So I like the idea that, you know, we're presented, you know, posting on Yakima Neighborhood Health Facebook page or the local coalitions and getting it out that way instead of looking at having to maintain a separate one.
And that was going to be my statement, is that a lot of times when people are building a Facebook presence, unless they already have a lot of people that are on board with what they're doing, getting those likes and getting those people to come to your page is not even available. And I know a lot of people will send me invites to theirs, and I go look at their page, and I won't even like it because I don't like what they're selling. Yeah. So it's like, but the presence, like if the health authority or the not health authority, district has their page up, and their health district will allow them to post on there what's going on, what's coming up, whether it's going to be a health fair or whatever it is that you're going to do, those regional events. And still that's a way to get the public to acknowledge that these things are coming up, and it's through their lens. And having, I know that here in the Tri-Cities we have a events page that you can post anything on there for free. And so those will come up, and I know a lot of community members that use those for future events coming up. I want to go see this, and they schedule the whole year according to what's already on that page. So there are other ways of reaching out to the public. And the other part is that there's a lot of different agencies out there that would love your presence there. You know, if you go visit and you say, hi, I am, and oh, I want to know who you are, it's amazing how that gets out there, and then you get referrals from just that.
Okay. And I will go back to my comment. Facebook is the least of my worries. I have 5 Facebook pages in public health. I can add another one. It's not going to take that much longer. There's a lot of other things here that are going to take constant work throughout the year that I'm not saying they're not important. I think they're all important. It's combining them and making a little bit broader face on it so that we can do the work together and maybe define it a little differently instead of I need to make sure I do this every month. I need to make sure I do this every month. All of a sudden, my time as the LHIN administrator and the money is taking up with me contracting somebody to make sure that I'm doing all these things versus using the money in the community. With 10 or 12, I could go to the LHIN meeting every month, bring up those topics, know that we were satisfying our contract, and still doing good and still working in the community and still doing those things. You see, I'm worried that the overburden of, I take this back to LPAN and I say, okay, who's going to do these? Who's going to be responsible for these? And they're going to go, you know, so I'm just worried about the focus of the LPAN money changing from being used in the community versus me using our own. That's my big concern. It's not that these are no good things.
Okay, so I've heard a couple of suggestions. So, and I think it would be helpful to hear your response. One of them was for you or your designee to meet with the different LHINs. One was to meet with the LHIN leaders. I think it's been a while since we've had the groups together. The other would be to have the LHINs meet and respond to this. And then the other was, and I'm going to paraphrase what I heard you two say, is describe what the goal is for in broader categories and let the Alahins respond to you on how they're going to meet those broader categories. Do you have a reaction on which of those you think will meet our needs collectively as the ACH?
Yeah, and I apologize. It was my idea to bring the contract to the board for review because it was really meant, and I didn't really meant to have it as an action item. It was really more of a discussion to say, is there anything that we should just take off the table? Because definitely some of these things have come from the board members themselves. And if there's things that you don't want to have happen, then it would be easier for staff to say, let's take that off the table right now, as opposed to taking that to the lens and having a part of their contract and getting them all riled up, because that's the last thing that we want to do.
Right.
That being said, I think there's only like 4 things that we added from last year's contract. So last year's contract really was the same as this year, except for the Facebook page, the workforce needs, the conferencing capabilities, and then we added, we wanted to see what you did with your 2018 funds, because in some instances, when I've asked that question, the LIN leaders have said, I don't know, we haven't done anything with it. So that's the last thing that we want to have happen, is that we don't want to spend $30,000 out and that there's nothing happening with that money. It is meant to be used in the community. And so I felt like that was an accountability issue with us. And then again, that conferencing thing is sometimes we have a hard time getting to your meetings. And so when we can't even call in and represent ourselves at your meetings, then it makes it really difficult for us to have that bidirectional integration. So we just didn't feel like that, and it can happen, with in partnership with the schools or whatever. But we didn't, I think that our easiest path forward then, I think, is if there's anything in here, like last year, we spent an enormous amount of time talking about the Medicaid Consumer Council. That took quite a bit of time to work through, and I think we lost a little bit of time. So if there's anything here that the board feels like we need to take it off the table before we even get that far, I think that would expedite signing the contract. So.
And the other thing, the flip to that, Carol, is that the things that the board has mentioned over the year that Carol's kept note of that we did put in here, it would be helpful for us when we go to the LIN to say, this was a recommendation by the board, we feel it's important, and so we have a little bit of your meat behind what's in this scope. So that's, again, why we showed it today.
So again, of the recommendations that you've heard today, does it work for you? To me, the most successful path is to give the LINs a chance to come back to you and say, can this work? Well, first question is, there are 4 LINs or 5? 6. Can you manage 6 different, or do you want them all the same?
So when is our quarterly meeting, Ruben? Because we sent out a doodle poll for the quarterly meeting.
We haven't done that yet.
Oh, right.
It'll be coming up shortly, though.
Yes.
Huh? Nothing. Okay. I thought we'd set that up. I'm sorry. I thought we'd sent out a doodle for that. So that would be the easiest, I think, is to set up a meeting with all of the LIN leaders to get feedback. We don't want this on the table. Then we can bring it back next month for the board to discuss. And whether it's on or off the table, then the board can just decide this is really important to the work of Greater Columbia, or it's not that important, let's just take it off the table.
Okay. That sounds comfortable to the board?
Yes.
Okay. Anybody on the phone have any additional comments?
Nope. Sounds good.
Sounds good to me as well.
Okay, great. Okay, let's do that then. Thank you.
Thank you.
Good discussion. Okay, so I do see that we have a conflict of interest statement in our package. You want to speak to this, Carol?
So this is the conflict of interest statement that we developed in 2016. Every year, the board has to sign off on it. So it's good to review, what is a conflict of interest? Why would we do that? And I think it's pretty obvious in the district program. almost everybody here has a conflict of interest, because if you're an organization that's receiving money from Greater Columbia and you're voting on that, then you have a conflict of interest. So we acknowledge it at the beginning of our agenda. We have tried to protect the board in some ways in the way that we set up the budget and the funds flow through the committee, so that those policy decisions are made ahead of time, so that when we're actually allocating them funding, you're actually just approving the methodology, you're not approving the funding for individual organizations. But there have been instances, especially like with the BHO money that's gone out that was voted on, that members have had to abstain because obviously they can't vote to give themselves $500,000 or $1 million because that is a conflict of interest. So I think we just have to acknowledge in this program that there is a lot of COI, and that we are just upfront and acknowledge it and abstain when necessary. And then Lauren has the signatory sheet, so that, and this is actually a requirement that in our STARS and our implementation reports and all the things that we do with the Healthcare Authority, we're continually asked for a proof of our conflict of interest statement and the signature page. So it's not just enough to say that we've done it, they want proof. So we have an attestation, and then we say, here's the proof of our conflict of interest, and here's our board members that have signed it. So it's really a matter of, we want to get paid for that deliverable, then just we have to do it as a board.
If we have a bunch of new board members, you'd want to get
Yeah.
all.
Yeah, everybody.
So every year, it's nice to bring it all around and say, hey, it's still on board.
So with that, I think Lauren has a page for people to sign for conflict of interest.
You don't have our names on it already.
Okay, any questions about this? I think you said this, but this policy has not changed. This is the one that we adopted in June of 2016.
And then there's, on the second page, it talks about the annual disclosure, so it's just something that we do every year.
Okay. So are you passing that around?
Yep.
Okay. Great. Okay.
And then similarly, the bylaws, in reading nonprofit organization best practices, this is an opportunity for the organization to go through the bylaws. We did revise them in 2017. We revised the nominating committee and some of the language. But again, it's an opportunity. We actually, this is part of our board orientation packet, so we provide all these things in the packet. And I think that the bylaws are just those guiding principles that guide our decision making. And if the board has a discussion that they don't like the way some of the rules of our board, then they can be changed. So this is our opportunity to talk about the bylaws and change them if there's something that you want to have changed.
Okay, any questions, comments about the bylaws? I don't see this on, but at the end, Sandra, are you still on the phone?
I am.
So at the end of last month's meeting, we had one unfinished piece of business, I think, by the nominating committee. And it's in our bylaws. We have one vacancy, I think, on the board, which was the position that John Sinclair held, and he was representing, remind us, public safety. And so I don't know, did you all convene the public safety sector?
Not yet, because John hadn't officially.
Okay, and so we need to take action on that, as we just signed a card for him. But on page section 10 says that absences for more than 1/3 of the meetings in any calendar year may be grounds for removal. And I think when we looked, Laura and John had only attended one meeting last year. And so it was my recommendation that we find someone that would be able to attend the meeting. The board removed John from the board and look for another member of the public safety sector that could represent that sector on the board. And so I guess I need a motion probably officially to go forward with that, to find somebody to represent.
John.
This is Sandra. I'll make that motion.
He has not officially resigned. It's
Okay.
our recommendation that we officially remove him from the board and find somebody that can attend. So I have a motion from Sandra. And a second from Brian. Is there any further discussion? If not, all in favor?
Aye.
Anyone opposed? Any abstentions? Okay, so then, Sandra, in your capacity as the nominating committee chair, would you work with the staff to convene the public safety sector to nominate a representative?
Absolutely.
Thank you, and bring that back to us at next month's meeting. Thank you very much. Okay, so
Ron, can I
then,
ask you about, wording about that real quick, about the motion for the minutes, please? So it's both, Sandra motion to remove John Sinclair, to, recommend, removing John Sinclair from the board and to find a replacement. It was basically both pieces together in one.
Yeah,
right?
that's fine, yeah.
Okay. Thank you.
So the practice transformation toolkit.
So this is, there's two on there. If you guys see, it says practice transformation toolkit and workbook. So the toolkit walks you through all of the milestones, the intent of each milestone. There's resources in there. It tells you the reporting quarters, if it's going to be quarters 1 through 4, quarters 2 and 4, or just quarter 4. And it also gives you the cadence, or the type of reporting that we will need, which will be either a selection, which is an X, the pound sign, which is data that we'll need, and then there's the N as the narrative, and that's within, I believe the third page that you see on there. And then there's the key for the reporting method. And then as you go along each milestone, they're broken down into sections. So for example, milestone 2 is broken down into 2A1, 2A3, 2A2, 2A3, and then 2B1, 2B2, and 2B3. Which each one has a different reporting method. And then this might look like a really big document, but it's really helpful. Us as a team with the GCACH spent a lot of time and revised it many, many times and did a lot of edits to make sure that it would flow good and it would make sense for the organizations and the providers to read. It also walks you through how to report on each of the milestones. I don't know if you want to go through some of the pages so that you can see. There's a table of contents, and it's broken down as you guys see there. And then it also lists the quarters and then the reporting method for each milestone. And then so there's the intent of the budget. And then, walk you through the framework, and all the milestones are set up the same way. And then if there's any resources that are available for that specific topic of the milestone, then they're listed on there as well with links that you guys can click, and I'll take you directly to more information about that topic. Anything you want to add, Jenna?
One thing, some of the milestones have a key question section, so that's not meant to be reported on by the organization. It's meant to stimulate discussion among their quality improvement team. So they can see like, what are we doing for example, self-management or medication management, just to kind of foster that discussion among the team. But Carol, I didn't know, did you want to go through detail on each milestone?
Okay. We might be here for a while. We are a reporting happy organization.
And with this document, the toolkit and the reporting workbook, each one has all the milestones, the deliverables, all in one sheet at the very end. So it's really like a nice high overview of the work that needs to be completed, but this gives you a lot more detail.
You want to do the last page, the milestones page.
So there it is.
See, Martha, just be glad you're not doing this.
You had a lot of milestones.
And we'll be sitting down with each organization and their QI team and go over the toolkit and the reporting workbook and do a walkthrough how they relate to each other. Answer any questions that might come up, like, hey, so what do we do in this section? And then we can answer your question.
And this is what you're hoping to put on the portal?
No.
You're not planning to put this on?
Well, it's kind of.
Yeah.
The reporting part of it.
If you turn the whole document into a reporting tool, which we've done, that will be what's on the portal. But again, it's like everything's expanded. If you took a drop-down box and expanded that out into a table, that could take up to a page. We're actually just going to be a single line on the portal. So once it goes on the portal, we're hoping it's going to condense quite a bit. And this, Sam developed this, and she knows more about this than all of us. It's taken from a standard industry framework for PCMH implementation that's adopted from CMS. So it's been pretty rigorously looked at.
And the nice thing about, and Sam, I think Sam's on the line if she wants to comment.
I am on the line. Yes, it was developed from CMS services from the PCMH model, as well as from Medicaid and CPCI, which is Comprehensive Primary Care Initiatives. It's been tested time and time again, several different states, and they have shown that it actually builds the skills and the fundamental set to be successful as a PCMH model, but also to be successful for population management tools.
And I think that the report this morning from Adam Asby really confirmed the lessons learned in New York was that there needs to be fundamental change within the practices in order to be successful at transformation. So I feel really comfortable that Greater Columbia has chosen this path, because I think in the end we're trying to get our providers ready for value-based payment, and this helps build the skills necessary to get there. And from the success stories that I heard this morning from all of the report out, it seems to be catching on, and the funding is being used to get risk stratification tools and expand capacity in the EHR. So this is just kind of, I know it seems maybe restrictive, but in the end, I think what our providers appreciate is having, a path to follow and understanding what it's going to take to become at least conversant in PCMH. We're not expecting certification, but at least understand the change concept.
Right. We actually, I got to go to Pullman Regional yesterday and got some good feedback from Dr. Earl there. And he just mentioned that he had sat on a panel or some kind of team like 6 years ago where this whole concept was discussed in like a big picture format. And he just expressed how grateful he was that something is actually getting done at the local level. And he was really excited to participate. So that was really good.
I was actually on that panel.
Oh.
I sat on that panel.
Glad you were there.
Oh, Sam. Sam, you're a go-getter.
She's a superwoman.
Yeah, and we have already started speaking with a few of the organizations, and same with Jenna. I've gotten good feedback as well. As the clarity of the toolkit and how it relates back to the reporting workbook. So far everything has been going good. Do you want to show them the workbook you have?
I don't have
Okay. No, that's something that you guys will see. Once either myself or Jenna meet with each organization, then we'll walk you guys through the workbook as well. But it's just what Wes was saying. If there's a selection, then there'll be like a table, and then you'll just select what applies to you. And if there's data that needs to be input, then you would just be entering the numbers. If there's a narrative, then you would there's a text box that you can just type in your narrative. But it's from our standpoint, it's a really good tool that walks you through how to report and what each change concept is meant to do.
And we've turned the toolkit and the workbook over to CSI, and they're working on trying to create a web form, and we'll be meeting with them tomorrow morning to talk more about it, see how that's going.
Can I add something else too, Martine, Jenna? Can you speak to some of the resources that I've had you guys experience within those toolkits, specifically on the shared decision making?
Yeah, so there's a whole milestone that centers around shared decision making. I think it's in milestone 5, to be mistaken. But it gives resources and links in there to share decision making tools. So basically what we want is we don't want to say you need to do this and not provide any tools necessary to actually have them do it. And some are interactive, some are printed off, but it really just gets that patient involvement in their care, also a part of the patient-centered medical home model. And they're actually really cool tools. Really, we played with them for like 30 minutes one day, just messing around.
Milestone 4.
Thank you.
Good
job, Les.
And those are, on the resources, that's the section where it's resources, and it gives you links where you can directly go to them. And they are really cool. We've gone through all of the links because we wanted to see what you guys were gonna be seeing so that we can be familiar with the content. And they're really, really useful links and tools in there.
And what's beautiful about it is that the learning collaborative curriculum follows the milestones, so that we do not expect the organizations to just use the toolkit or the resources, but we're offering learning collaborative sessions that will take you through each milestone, so that for next month it's the budgeting, so that we will assist and provide technical assistance beyond just the practice transformation navigators to help go through each milestone. And the opioid summit that we're trying to develop will also be another learning collaborative opportunity to have MAT training and how to use the PDMP, and if they don't know how to use EDI or pre-manage, there will be a bunch of tools that will be available during that learning collaborative. So we're trying to set it up so that everything's being reinforced through all of these different crosswalks.
Which we did already. We had our first learning collaborative.
Yeah.
Walked through the contract and walked through the toolkit. I thought everybody was really receptive and really appreciated. I've gotten a lot of really good feedback from it, especially on the contract side. Everybody liked hearing the same message all at the same time. And same with the toolkit. So it was a good meeting.
Yay.
Yeah.
Thank you. Okay, sustainability.
Carol, I also wanted to add on some of those resources, just like First Steps, American Medical Association, there is curriculum that is associated with that will give CME credits as well.
Okay. Thank you, Sam.
Welcome.
All right.
Sustainability. So we're not going to have the discussion on sustainability today. We wanted to ask the board how you want to have this discussion. This is happening across the state.
We want you to figure out how to be sustainable. I don't know how we're going to do it. I don't know. I'm just sort of speaking for myself and pretty much everybody else around the table.
So some ACHs are taking different tacks. Some are using the data analytics capacity that an ACH might be able to build to be part of their sustainability plan, like Adam Asby was talking about today. Some are linking into community foundations, and attaching to community foundations like Better Health Together, who is a really big community foundation on their side, the Empire Health Foundation that has about $2 billion. As part of their sustainability plan. But I guess the first question is whether or not Greater Columbia ACH wants to be sustainable. That would be the question for the board. And then if we want to have that discussion, how should we have that? So my suggestion would be a retreat, bring in some information, bring in a facilitator so that we can have a little bit more relaxed conversation around this topic, and then offer up some ideas from the staff where we've heard from other ACHs, and just have a you know, it's on the table. I know we've talked to Sue Birch about it. The MCOs have said, we can't be your sustainability plan forever and ever. And I know that Sue has her own ideas, and when she comes and visits us, probably either next month or March, you know, it'd be nice to say, yeah, we're thinking about that, Sue, you know, and this is kind of where we're at with that. But so we just wanted to know how you would like to have this conversation.
Can I make a suggestion? You guys have a retreat with self-care also implemented because you guys work really hard. I'm not kidding.
Like we get a massage?
Like a spa retreat? I'm totally serious here.
Hawaii.
I'm totally serious.
No, I have not.
I'll come teach self-care, okay?
Thank you.
It's an important piece for you guys. You guys work really super
Are
hard.
we 2.5 years into this, or are we?
So the program will end 2021.
So are we? I'm sorry.
Yeah, we were done.
Are we 2.5 years into this? We're halfway into this.
It actually might go a little bit longer because the reporting cycle
Right.
kind of carries into 2022.
Yeah.
So, but yeah, it's got a finite lifetime.
No, it seems like we're really early into the process
Well,
to me.
for what we gotta do next, yeah.
Because we're at the implementation phase now.
You know, it seems early, but listening to Adam, I mean, I think we're almost late in getting started on this. He mentioned a bunch of ideas, and again, this is not the venue to develop ideas, but things like, you know, being consultants, becoming an IPA, an ACO, a health home, looking to a community foundation, you know, the Pathways Community Hub, which we're doing as the Health Commons. I think that there's a lot of things to think about and explore, you know, in our mission to support providers so that they can be successful under value-based payment. When I keep on referring back to this survey that Healthcare Authority did, when they asked providers, what do you need? They need interoperability, they need population health management data, they need cost data. I think that there's, we think that there's ways that we might be able to serve our population of providers.
I think my reaction in feeling like it's early, and I agree with everything you just said, is what information do we have to prove our value at this point?
Right.
And in order, to me, that's the biggest thing that we need in order to have people buy into our need for sustainability. And I don't, and maybe you have information that I don't have.
Well, we just got a report on Monday from GCACH on their evaluation of ACHs. And so it was a little late to add to the agenda, but we can certainly talk about that. And then we got our own individual results just yesterday. So on our ACH and what our ACH participants think of us, and where we stack up in the group of 9, of which is, we're a little bit ahead of the 50%, you know, but we're not, you know, and it's all self-evaluated, right? So, but the CCHE results are really interesting, and we can bring those to you guys next month, or it could be part of the retreat. However you
I
want to
think
do
a
that.
retreat is really a dedicated retreat on the topics, good, if assuming we have information to work from and a facilitator that can lead us through that.
As well, as a facilitator, but maybe someone who's trained in some kind of human design thinking. That would allow for the effective use of the data and the process.
You know, just elaborate on that.
What is human design?
Yeah.
I'll share that.
Careful when you ask it.
So, I mean, we're kind of using, it's a way of using individuals' experiences as each participant and creating a process to generate ideas that, I mean, if our target is sustainability, then we use each one of our experiences and and facts in generating ideas, targets that are actually reachable and doable and achievable. So, but there's a whole process of facilitating that, and there's experts who can help us with that process. So,
So somebody else have their hand up. My periphery just went like this, and I saw somebody's hand go up.
Mine did, yeah. But I'm serious about the self-care thing.
I just figured.
They better take it.
I hate to say this right now, but the federal government has actually done quite a bit of investing with their human services
there's like, innovative thinking, innovative outside the box think, there's facilitators that do that as well.
I hear there's a bunch of federal employees that maybe need
Yeah.
They need some work.
So, but again, you think in the reports that you have, again, I think, and I don't know who the facilitator might be, but, and we collectively, will we have information to work from?
Yeah, I do think so.
Okay.
Yeah, and sustainability is another agenda item on the CFO meeting next month, so I'll be able to collect data from the other ACHs about what they're doing, which I know, like Carol said, they are doing. Because when we were at the State of Reform, there was one whole session that was with two of the ACHs talking about what they're doing for their sustainability. So we have that information also.
Which ACHs were doing that?
Better Health Together.
And Better Health Together.
Okay.
Yeah.
So there's always going to be some kind of crisis, health crisis, so there's always going to be a reason for the ACH to exist because there's new information every day about different new things coming out, better management of how to take care of patients. So this is going to be a continuum, I think, of a need.
Again, my right eyes were over here. Somebody over here had their hand up. Okay.
Yeah, that's way back.
I could, I'm just doing this.
So I guess I'm
send you some
gonna
information.
come back to that thing that I keep harping on from the whole thing. When we started as an ACH, we weren't looking at specifically funding a bunch of people to do transformation things. We were looking at what our communities needed to become healthier and provide healthier citizens. I know that's an altruistic thing, and it takes money, I guess, to do some of those things. But I think that it's really worth, whatever we're thinking of, don't forget that it's really important for us to remember all those things and people that don't get to be part of the standard healthcare system that really affect all of our health. So I guess I just want to remind us that we have started out with some ideals that I'd like to remember.
Comments or thoughts about sustainability? Madeline?
And I agree. I think, really looking at, the elements that we've created and how we can sustain that into the future. And so being able to have some good outcome data to help guide us with that, I think would be, for me, helpful to see, where we're having the impact and how we can help move that through our community.
Do you have a time frame in mind, Carol?
I'm so glad you teed up that question. So for the board members, unfortunately, I think I only made 20 copies, so make sure all the board members get that. I kind of penciled in April for that discussion. And this is just kind of the first few months of the year, and this isn't a schedule that's been totally fleshed out. I've just basically started on filling in some of the months and the work that's due that we know that's going to happen. But I was thinking that around April would be the time that we would have enough information together that we could do the sustainability retreat. There's a bunch of other things that are happening too. So the opioid summit, that very, very exciting stuff that is happening finally in collaboration with our partners, and that we are, we're well down the road with PCMH. We've got those organizations set up. We've got the practice transformation navigators that are doing that, so that can be kind of just a kind of stream of consciousness. We're just doing that work. But in addition, now we can really, I think, have some impact on the social determinants of health. And we're doing that in a variety of different ways through the dissemination of the Community Health Fund, working through our LINs, getting the sponsorship dollars out, looking at workforce. But I think that we have been approached now by different organizations saying, would you be willing to do this? So for example, Megan DeBolt, would you be willing to have a behavioral health summit in Walla Walla? Approached by Lourdes, would we be willing to do a housing summit in Benton and Franklin counties because we're in kind of a difficult situation there? And so I think that the work that we are supposed to be doing, which is to convene and to gather these partners, now that we kind of understand the communities and we understand their resources, we're starting to have some opportunities to do that. So you'll see in this work plan that there's several summits that we're planning on, and that we're also incorporating those into some of the learning collaboratives. So January looks pretty heavy because that's what we knew, but as we go forward, it thins out only because we haven't filled in those spaces yet. The other thing that we have on the horizon is, in order to be able to send out the scholarship money, then we have to have this workforce study and these meetings with the LINs to get the data at the local level. Then we've got the LIN quarterly meetings that are scheduled. The practice transformation work group will meet following the month of reporting so that they can evaluate the metrics that we're getting from the PCMH organization. So there's some things that are prescriptive and some things that are kind of flexible. We have been talking about a resource directory for about 2 years now. I'd really like to finalize what that's going to look like, who the vendor is going to be, because we keep hearing that, one of the important aspects of understanding is how to connect with these services. So I think that we had a great report from Corey this morning about the launch of the 211 and some of the new technology that's coming out from that. But we know that we need to get something like that into the provider's hands. Wes is working on another Health Commons project. We'd like to have a third one this year. So this just gives you just some really rough idea what's going to happen in the next few months. And then if there's something that the board wants to take off the table, or if you want to add something. Oh, the other big thing is the ACES campaign. I had a great conversation about that yesterday. Was that yesterday, Ruben? And how to get that started. So we're really starting to do some really fun and interesting things outside of practice transformation that now are addressing our community-based organizations.
Susan, did you have a comment? Oh. Pondering. Okay. So your hand go up, so just checking. Any questions or comments?
Looks like a lot.
It is a lot.
I mean, is this on top of making sure that all the providers lead us to move the metrics in the right direction?
Yep. So, we have a minute. So the last couple of months, we have talked about the ACES campaign. Do you want to give us an update on the conversation? Sure.
Yes, yesterday we convened the communications committee for them to give me some general direction on how to move forward. I provided them with background on the ACES conversation up to this point. So they, after we went over the details of how the conversation has gone so far, they went ahead and directed me to put together a task force of people that are closer to the ground and working with ACES for them to then help put together the actual campaign to give a more detailed framework on how to move forward. So right now, for next Wednesday, we all agreed that they will send me some names of people that would be good members of the task force, their names, their contact information, and the sector they work in. So we're moving forward.
Ruben, were you going to send out a reminder email for us to do that?
I was planning on it anyway.
Okay.
Yes, I will.
Yes, please.
I made a reminder.
Yeah, thank you. That sounds like a great plan.
And I have just one other thing. I'm going to give kudos to Carol for her representation of this ACH and all ACHs at the State Reform Conference and asking really, really good questions at really good times. Because that doesn't always happen in ACHs at the state level. And particularly when you get into the higher policy ranks, has kind of a mixed review. And Carol did a great job of, again, asking really, really good questions at really good times.
Yay,
Carol.
Yay.
Always a good thing. Part of my sustainability plan.
Be heard.
That's good. Well, that actually takes us to the end of the agenda, I think, right? Am I missing anything? So does anyone else have anything that they would like to share, put on the table?
Just a quick note, the World Health, in terms of this agenda, the World Health Conference, it's going to be at GCACH, March 7th. We are looking at doing a very specific kind of workforce activity that will be, all the ACHs will be invited to that the afternoon of the 27th after the conference ends around noon. So I'll give you more details about that.
And so it's the 25th? Can you send those dates out?
Yeah, the 25th through the 27th, and it will be at GCACH this year.
That's awesome. It was one of the most valuable conferences I attended last year. I have one more thing. In the bylaws, we were talking about the finance committee, and in the bylaws, it does specifically talk about the finance committee and that we're supposed to have 3 directors on the committee. Just throwing that out there.
So we think we have 3, as long as Julie doesn't. Well, no, we have Jorge, so we do have a minimum of.
Okay.
So that's good.
That's good.
So it's Brian and whom else?
And Rhonda.
Oh.
Brian and Rhonda are 2.
Jorge, before you leave, I want to talk to you.
Okay, then.
Is there anything else for the good of the order?
I mean, for the workforce committee?
Yeah.
Yeah, I don't know.
If not, this meeting is adjourned.
All right.
Thank you all.
Thanks, Rhonda.
Thank you, Rhonda.
Thank you.
Hey, I don't know if you.
I just sent an email to me.
Okay, but,
They listed this on their agenda.
okay, opening for